I have no disclosure, but I would like to acknowledge ICS for the Conference Travel Award, and also the Quebec Network for Research in Aging and the São Paulo Research Foundation for their support. Sorry, okay. So pelvic floor muscle training is the first-line treatment for women with stress urinary incontinence, but it's also recommended for mixed and less commonly in isolation for urge urinary incontinence. From the last update of this Cochrane review, new trials were eligible for inclusion, so an update of the current best evidence is needed. Our objective is to test if pelvic floor muscle training is better than no treatment, placebo, sham, or any other form of inactive control treatment for women with urinary incontinence, using a Cochrane collaboration methodology for systematic review and meta-analysis. 9 new trials were included in this update, and for the first time on women with mixed urinary incontinence only, and on women with urge urinary incontinence only. We also, for the first time, had one trial that presented an intervention exclusively by a smartphone app. The trials were generally of small to moderate size, with moderate risk of bias. In a total, there were 30 trials from 14 countries, accounting for over 1,700 women, with 26 trials contributing to the meta-analysis. There was a wide variation in population, intervention, and outcomes. As examples, some trials focused mainly in pre- or postmenopausal women, and some other in women with osteoporosis and athletes, among others. For the intervention, there were programs lasting from 1 to 24 weeks, some of them with progressive treatment techniques. There was a wide variety of outcomes, and we could see, especially for the new trials, grade A questionnaires for symptoms and quality of life. For the primary outcome, women with stress urinary incontinence in the pelvic floor muscle training groups were about 8 times more likely to report cure, which was based on 4 trials. And women with urinary incontinence of any type were about 5 times more likely to report cure. For cure or improvement, women with stress urinary incontinence in pelvic floor muscle training groups were about 6 times more likely to report cure or improvement, which was based on 3 trials. And women with any type of urinary incontinence in pelvic floor muscle training groups were twice as likely to report benefits. For the secondary outcomes, we saw that women were more satisfied with active treatment, whereas control groups were more likely to seek for further treatment, and that women treated with pelvic floor muscle training leaked less often, lost smaller amounts, and emptied their bladders less often during the day. The persistence of benefits in medium and long term were supported by 3 small to moderate-sized trials. And for those women with mixed or urge urinary incontinence only, the new trials reported that pelvic floor muscle training group was associated to better quality of life and reduction in leakage episodes. In conclusion, we can say that the wider range of population, countries, and high-grade outcomes within these new trials emphasized the strength and recommendation for women with stress urinary incontinence, and now we are also starting to show benefits for women with mixed and urge urinary incontinence. For the long-term effectiveness of pelvic floor muscle training, we still require further research. Thank you very much for your attention.
We're open for discussion. What is the type of detail that can be derived by these publications on the type of pelvic floor muscle training that these women underwent? So is there any type of descriptive analysis of what do these women really did?
As an inclusion criteria for this review, we included conservative management of urinary incontinence, so usually it's pelvic floor muscle training with a physiotherapist. Most of those trials included supervised training. We also had, as I showed you, one trial that provided the training only by the smartphone app, but there is a wide difference in the protocols, but most of them do different series of contractions and relaxation techniques.
Please.
Hi, Jenny Russell, UK. Thank you for that study, it's very good. How often did you meet with the control group weekly? How often were they seen? Or were they just seen once?
So, as an inclusion criteria for this systematic review, we only included trials that had a control group without any kind of treatment. So it's an active treatment. It could be a sham treatment, it could be a waiting list. Some of them, the patients were seeing only for the evaluation, pre and post-treatment, and they were in a waiting list. Some of them had some educational pamphlets, but none of them were allowed to have any kind of exercise of any type.
Okay, so once you saw these people in the control group, were they left to do the exercises at home on their own, or you just didn't?
It's because it's a systematic review, so there are different trials with different methodologies, and as I told you, we have to establish inclusion criteria for this review, and the only rule here was it had to be an inactive group without any treatment that could be a confounder for pelvic floor muscle training. Okay. It's very hard to blind this kind of studies, so it's not possible for treatment versus control to be sure that the participants were equally expecting the same thing from both groups, but what I can say is that all these 30 trials, they met our inclusion criteria.
Thank you.
Wonderful. I think we should go to the next study. Thank you so much.